Welcome to Thursday's Zoom. I'm glad to see all of these faces, and Miss Crystal and her class have joined us. Welcome to you all. I'm excited. I'm going to try not to be nervous because there's so many of you. You know, even instructors get nervous sometimes. I know y'all get nervous about saying things, and except for Chase. Chase is never nervous. He's outgoing. Don't you think so, Cheyenne? And he just...
Don't show
Chase is the boss. Chase is the boss.
Don't lie.
Chase is the boss. And I know that Miss Crystal has a few that are too. So today we're going to be discussing something a little different. We're going to be discussing something called the CMS 1500 form and prior authorization. Now, I'm going to show you this form. It's red and white, and you may think, oh my goodness, what am I going to do with this? I just want to tell you, I very rarely use this in coding. I don't think it's not used a whole lot anymore. But in case you have to use it, I want you to know what's there. And for Miss Marcia's OMBC, please take notes because this will be on your final exam. So, that being said, if you don't have pen or paper or somewhere to make notes, please, please, please get that. And if I know Miss Crystal, she's jotting down some stuff too to put in y'all's final exam. So I'm just saying, you may want to take a few notes. So in our slideshow today, we're only going to hit boxes 1 through 7 and box 23, and you'll understand what I mean. I'm going to share my screen with you so we can get started. Oh, my OMBC, I've learned how to use Canva and I love it. It's so cute. Sorry. Okay. It's all right. Can y'all see?
Yes.
All right. So CMS 1500 form and prior authorization. This is actually what the form looks like. Yes, it's small. I can't make it huge for y'all, but you get the gist of what the form looks like. It looks very intimidating, doesn't it? I promise you it's not. It's not going to be intimidating. So the very first thing we're going to do is watch a video. Now, he is a bit monotone and it's not exciting, but it only lasts a few minutes. So bear with me and let's pay attention and take notes on what he's telling us goes in each of the boxes and some of the important information that he's going to give you. For example, how should you put your patient's name on a CMS 1500 form? Where the insurance part goes, you have to put it exactly the way it's listed on the insurance card. So that's just one of the pieces of information he's going to share with you. And we're not going to sit through all of this. I'm actually going to go through until
1 to 13, refer to the patient and insurer information.
Okay, I'm back
Item numbers 14 to 33, refer to information about the provider.
Let me back it up just a little bit. All right. I'm trying to adjust my sound. All right, here we go.
Or data boxes. Item numbers 1 to 13 refer to the patient and insurer information. Item numbers 14 to 33 refer to information about the provider and diagnoses, procedures, and charges. For simplification purposes, the videos will address separately item numbers 1 to 7, 8 to 11, 12 and 13, 14 to 20, 21 to 23, 24, and 25 to 33.
Remember, we're doing 1 through 7 only in box 23.
Item number 1 is used to indicate the type of insurance the patient has. 5 specific government programs are listed, as well as group health plan and other. Other can be used to indicate individual health plans, HMOs, commercial insurance plans, automobile accident plans, workers' compensation plans, etc. Item number 1A is for the insured's ID number that can be found on the insured's insurance card. Item number 2 is for the patient's name. It must be exactly as it appears on the insurance card. Item number 3 is for the patient's birth date and sex. Enter the date in 8-digit format. Month, date, CCYY. Use the 4-digit format for the year, even though the item box indicates only a 2-digit format. Item number 4 is for the insured's name. Use the full name of the individual who owns the policy. Separate the name with commas. Item number 5 is for the patient's permanent address. Do not use a temporary address. Item number 6 is for the patient's relationship to the insured. Item number 7 is for the insured's address. Do not enter the telephone number, even though it is requested in the box. Well, that does it for item numbers 1 to 7. In the next video, we will address item numbers 8.
Okay, so fairly boring, right? But his voice is not engaging as mine, but he gave us just what we needed to know. He gave us some great information. So for example, if you sent in a CMS 1500 form and you only put 2022 as the year, what would happen? They would kick that back, right? They're not going to take it. So that's great information to know that they need 2022, right? It's also great to know that when you click, push other or you check other on that form, it means that you can put your HMO, your PPO, your workers' compensation, and then otherwise it had like Medicare, Medicaid, Champ VA, Champ Bus, and it was different things. So also, you must put the name exactly as it's found on the insurance card. So if Bobby Jones is your patient, but it says Robert P. Jones on the insurance card, you got to use Robert P. Jones, right? And not Bobby, even though that's what he goes by. It has to match the insurance card, because if it doesn't, they're going to kick that back to you. So that may sound remedial to you guys, but you're going to use this all the way across the board, not only on the CMS 1500 form. So it's just important information to have. The next part of our little presentation is going to be on Medicare Part A. How many of you know what Medicare Part A pays for? Ms. Crystal, you can't answer. Nobody? Well, let me tell you what, you're fixing to know. So let's go ahead and we're going to go back to the share screen and we're going to talk about Medicare Part A, Part B, and Part D. So I want to point out that Medicare Part D is easy because it's what it stands for. Medicare Part D pays for drugs. I had a student that used to tell me that Medicare Part D paid for dental. No, it pays for drugs. Okay, so both Medicare Part A and Part B are federally funded plans that come with different coverages. Part A is free, and the patients need not pay a premium for the coverage. People have to pay some premium for availing themselves of the Part B coverage. Part A can be called hospital insurance, whereas Part B can be termed as medical insurance. Part A covers inpatient care, nursing facilities, hospital facilities, critical care access to hospitals. Part A also covers home health and hospice. So if you have a place to make notes, please make notes. We will be sending this video out on Genzabar also if you don't have a place to take notes. So now let's talk a little bit about Part B. Part B insurance will compensate for all medically necessary supplies and services. It also covers outpatient care, physical occupational therapist, doctor services, and home health care. For getting Medicare coverage, this is really, really important. For getting Medicare coverage, one should be 65 years of age and must have paid to Social Security or to the railroad Retirement fund when they were employed, but for Part B, there is no need for any Social Security credits. That's because you pay for Part B like you do your United Healthcare or your Blue Cross Blue Shield. But Part A is free when your patient turns 65 or they're disabled. Some disability patients have Medicare Part A. Make sense? Y'all got it? Okay. This is a sample of a Medicare card. So we have our patient's name, John L. Smith. Somebody write that down for me because we're going to be doing an exercise and I'm not going to be able to see this card. So his name is John L. Smith. His Medicare number is 1EG4-TE5-MK72. His date of birth, I've added it here because it's not on here, is 7/20/1965. And his address is 5932 Conley Drive, Pineville, Louisiana, 71360. Now, this is not going to be on the card, but when your patient fills out his new patient paperwork, you're going to have that information, right? So I'm just adding this because we're going to do a little bit of an exercise together. So I'm going to gather this. I'm going to copy it. And then I'm just going to go into my Google search bar, paste it. And we're going to fill out number 1 through 7 on a CMS 1500 form. And it's going to take a minute to load, but it's coming. All right, here we go. So this patient, John Smith, what kind of insurance did he have? Medicare, Medicaid, TRICARE, CHAMPA, group, or other? I showed you a Medicare card.
Medicare.
Right? Yeah, it's Medicare. So it's Medicare. So that goes in data box 1. So 1A says insured's ID number. Did somebody write it down for me?
I got you.
Okay, let me hear it.
Cheyenne, you want to go?
No, go ahead, baby.
1, E as in elephant, G as in giraffe, 4, dash, T as in Ted, E as in elephant, 5, dash, M as in Michael, K as in Karen, 7, 2.
Okay, so that was our insured's ID number. Did you guys pay attention to where that was on the insurance card? Okay, so now we have his name. His name was John L. Smith, and that's how it was listed. Oh, look at what I did.
Oh, you like to party type.
So John L. Smith, and what was his date of birth?
7/20/65, I believe.
And can we just put 65 or do we have to put 19?
No, it's 1965.
And is he male or female?
Male.
Male. What would happen if you accidentally put female here?
It would kick it back.
It's going to kick it back. It's going to kick it back. I have a little story to tell y'all about that in just a few minutes. But then this is the insured's name, then his address, and how is he related to the insured? It's himself, right?
So
Right. And so that takes care of 1 through 7. And I'm not going to type all of that in. But do you guys see how easy that is? It's not hard at all. And most facilities have this PDF filler for you, and then you would click done, and it would process, and then you would send it to the carrier. So it saved my changes. And I don't want to save it to anywhere, so we're going to get out of it.
Let's see.
All right, so I think that that's fun. You guys can get in your Google and you can make up information and you can practice filling those out. So the next thing that we're going to talk about is prior authorizations. Now, here we have a portion of the CMS form on 23, in box 23. That's where you put prior authorizations. So we went from 1 through 7. I know I skipped down to 23, but let me tell you something. When you're working in a facility, 9 times out of 10, if you get something kicked back, it's because you did, well, I'm not going to say 9 times out of 10. Let's say 7 out of 10 times. It's because you don't have the authorization on the form. So it goes in box 23. Isn't my little phone cute? Because you got to call to get the authorization number. Okay, so this is a little bit of a video, but I promise this one's better than the other one. Y'all don't hold me accountable for the boring one. But it's all about what is a prior authorization.
You and your doctor have selected a new medicine to treat your condition. You're relieved. You're hoping this treatment will work better than the last, and you're hoping that it will improve your quality of life. But before you can fill your prescription or have it administered in the doctor's office, you may need your health plan's approval. It's a process known as prior authorization. Prior authorization may require your doctor to submit paperwork, along with your lab results and records. It can be a multi-step process. If the health insurer finds an error in the paperwork or determines that you don't meet their requirements, they can deny the request. You and your physician can appeal, but the insurer may deny your request again. The process can block access to your medication for days, even weeks. Prior authorization is intended to stop unnecessary use of costly drugs, but for health plans, it has become a tool for cutting expenses, especially for innovative drugs like biologics. For doctors and other healthcare providers, it's a drain on time and resources, and a distraction from patient care. And for patients like you, it's a delay that can be frustrating, even dangerous. Consider patients with chronic conditions such as severe asthma, eczema, or high cholesterol. Waiting for the medication or device they need can leave them untreated and unprotected. In many cases, the insurer finally approves the treatment, but some patients simply don't have the time or the energy to fight through a multi-step approval and denial process, especially when they're ill. They may give up on treatment altogether. Using delays and denials to block patients' access to their prescribed medications cuts cost at patients' expense. Some state lawmakers have introduced legislation to put common sense limits on prior authorization. These efforts are important for patient access. Limiting burdensome prior authorization can help restore you and your doctor's ability to make personalized healthcare decisions, ensuring that the doctor-patient relationship, not health plan cost-cutting, determines your course of treatment.
We're going to talk a little bit more about that, but let's get through the slides first and then we'll talk more. So prior authorization, also called a prior approval or a pre-authorization, is a process that many health insurance companies, as well as Medicare and Medicaid, use to manage costs. Before you can get coverage for certain medications, tests, procedures, surgeries, and medical devices, you need to get prior authorization. Without prior authorization, you may end up paying the entire cost or being denied the treatment. They're kind of talking to the patient here. Somebody's given me lots of feedback, so can you make sure you're muted, please? So who needs to get the prior authorization? What requires prior authorization can vary from one insurance provider to another. It can also vary from plan to plan, year to year, or state to state, which makes it as clear as muddy water, right? How are you going to know? Well, because there's going to be things that are already there at your facility to let you know what needs to be authorized. You will learn very quickly. Okay, let's look at this. Look at this example. Your dermatologist's office creates a request and submits the information required by your insurance provider for prior authorization. What you need to know. Your dermatologist's office will let you know what is required of you when requesting the prior auth, or the pre-auth is what I've always called it. You may only need to keep track of updates coming through the patient portal or wait for a call from your dermatologist on a decision. I know working in cardiology, very rarely was the patient ever involved in prior authorization. We did that as part of the office staff. Your insurance provider informs your dermatologist's office, or you, of its decision. If pre-approved or denied, the following could happen. If the prior authorization is approved, you can go and refill your prescription and begin your treatment, or schedule the testing that your dermatologist prescribed for you. If it's denied, someone in your dermatologist's office prepares the materials required to appeal this decision. So who will be doing the appeal? You will. It's going to be part of your job. You're going to be appealing. What you need to know, sometimes the insurance provider tells only the patient of its decision. The patient's going to let you know if they can't have their medicines or their tests. If your insurance provider contacts you, reach out to your dermatologist's office to let them know the decision. If the insurance provider denies the request for prior authorization, you can appeal it. Okay, so I'm going to stop and we're going to talk about prior authorization. So who has any questions about prior authorizations? Have any of you had experience with prior authorizations?
I have been a pharmacy tech, and it's no fun.
Right. So DeQuita, how did you know what needed a pre-authorization and what didn't?
It usually pops up, or once we try to fill the prescription and realize the cost is extremely high, then we would request for a prior authorization through our system, or our senior tech would have to call the doctor's office and get them to send and approve the prior authorization.
Absolutely. So that's from a pharmacy standpoint. Does anybody else have an experience like in a doctor's office? Okay, I'll just use some of my coding. Vantage Insurance, which is based in Monroe, so all my Monroe folks may recognize that name. But Vantage is based in Monroe, and let me tell you what, you needed a prior authorization to go to the bathroom from them. So anytime I saw a patient that had Vantage, if I didn't see a prior authorization on my paperwork, I would call the office. If they didn't have it, then they had to call Vantage. I worked at a billing company, a billing and coding company that was outsourced. So it is the office staff's responsibility to get that prior authorization. If you bill out something, or you code and you bill out something that needs an authorization and you didn't get it, the insurance company is going to send it back on your AR report and or in your denials, and they're going to say, hey, I need an authorization for this. Okay, so let me ask you something. If they're asking for an authorization on a procedure that does not need an authorization, what do? You've gotten it back. They said, hey, we need an authorization number. You're going to appeal it. You would appeal it. So again, there's lots of things you do that, oh, sorry, tongue-tied. There are so many things you're going to learn on the job, and working those denials is going to be one of those. I like it because it's like a puzzle. It's like I'm a detective. Let me find out what these people want, and if I can't give it to them, why they need to pay it anyway. I got denied one time because my doctor did a surgery, cardiology surgery, and he needed to be paid for a particular instrument. Usually instruments are included in the surgical package, but this was something that was not included, and it was necessary. Y'all, I argued so heavy and hard, But he couldn't tell me no. You know why? Because I had my list of reasons and whys and medical documentation. And let me tell you, when I sent that appeal back, it got paid the next time because there wasn't anywhere for that insurance to go. If they don't have to pay or they can find a way not to pay, guess what they're going to do? They're going to do it. So as a biller and a coder, you have to be able to call that insurance company and say, let me tell you, this is coded correctly, the correct modifiers there, and I'm sending an appeal along with all medical records. Again, who feels like, oh my goodness, I can't do that? Who feels like that? Probably most of you do, and you'll want to raise your hands. Let me promise you something. It's not going to be that way for long, because just like when you're a cashier at Walmart or you're a bank teller at the bank or whatever the job may be, they train you, right? So some of this is going to be verbal knowledge. It's just going to say, oh, we talked about that in class, but you don't really know anything about it. But when you get that on the job training, they're going to teach you so much. So any questions? All right, so we're going to do a test your knowledge, and you guys can say the answer out loud and let me know if you know it. So let's go. We're going to go back over to our slide. Okay, so what is found in box 1 on the CMS 1500 form?
The insurances.
The insurances. Can y'all give me examples of what insurances are there?
Medicaid, Medicare, Chapter A.
Yep. What does Medicare Part A pay for? Courtney, don't answer. Somebody else give me just one thing. Tell me one thing.
Inpatient hospital stays.
I'm sorry, say that again.
Inpatient hospital stays.
Yes.
Care in nursing facilities,
Yep.
hospice, and home health.
Very good. Very good. What does Medicare Part D pay for?
Drugs.
Are you sure it's drugs and not dental?
Drugs.
It is drugs. Medicare Part D pays for drugs. D for drugs. I mean, that's pretty easy, right? Who can tell me what is a prior authorization? And I just need a synopsis. It doesn't have to be perfectly worded.
It's something used by a process used by some health insurance companies that will cover prescribed procedures, services, or medication.
Right. So a prior authorization is something you get before a procedure or before, I don't know if drugs are the same. I'm just going to say on my end in my experience. So patient has Vantage insurance. They need to come in for a heart catheterization. I got to call and say, hey, this is the patient's name. This is their member number. I need a pre-authorization for their heart cath. And then they're going to say, okay, what's the medical necessity? That's when you would give them diagnosis codes. I know that that's a little bit more information. They're going to teach you how to do all of that, but that's kind of how the process works. What is found in box 23 of the CMS 1500 form?
Payer assigned number authorizing the services.
Right, it's the pre-authorization number, right?
Okay.
And say again, whoever said that out loud, what you said.
The payer assigned number authorizing for services.
Yes, is an authorization number. Okay. Would your claim form clear without adding the sex of your patient?
No.
No.
Will it clear if you give them the wrong sex?
Nope.
No.
Or I'll get kicked back.
You're going to get kicked back. What age are patients eligible for Medicare?
65.
65 and over.
65 and over, or what's another way they can have Medicare?
Disability.
Disability.
So those questions weren't too hard, were they? It
No.
covered exactly what we talked about. I am going to tell you a story about checking the wrong box. This was not on a CMS 1500 form. This was just on my electronic claim form. And Medicare, it was a Medicare patient. And I'm gonna tell you something, when you guys make a Medicare, a mistake billing Medicare, they don't tell you what's wrong. They're like, if you can't figure it out, I'm not helping you, because if you can't figure it out and I'm not helping you, I don't have to pay for it, right? So I had this denial, y'all. And when you look at something so hard, for days, I looked at it. I called Medicare. I kept matching up the information. And it was because I had it marked as male when she was clearly a female. So if you ever get a kickback, start with the easiest things first. Check your date of birth. Make sure you didn't transpose a number. Check your ID number. Check the spelling of the name. Check to make sure that you have it correctly identified as male or female. It just, you have to. So that's just something that I learned myself, and I try to pass on, because you won't believe how many times sorry. The mail lady knocked on the door. I apologize. So I think I saw Angela Briggs here, and she had her hand up.
Did have a question.
Okay, yeah.
And it might be a stupid question, but
There's no
it popped
such a
into my
thing
head
as a stupid
before.
question. No such thing. Go ahead.
Well, especially when you were talking about the female and male, marking that on the CMS form. So what I know that they've been making changes on things regarding the male and female stuff. So that's apt to change at some point, possibly, right? How are they going to deal with that?
Well, on your birth certificate, it's clearly labeled male or female. And I was going to bring this up, Angela. This is such a great question. This is a great question. You have to mark what they were born as. And until they change it to other, there's nothing, nothing you can do about it. Has nothing to do with you personally as a biller or anything to do, you can't do anything about that, but you have to mark what they were actually born as on their birth certificate.
Okay, I was just curious because I don't really see any leeway on that when it comes to
No,
medical.
No, there
issues.
isn't a lot. No. And thank you for that question. That is that wasn't a silly question, girl. That was a fabulous question. I like that question.
I thought it might have been considered a political question.
Yeah, those can be hard, and that's probably I kept thinking, should I bring it up, but I didn't. But I'm glad you did, because it's something that's a very real problem in the world. And I'm not saying problem as in I have a problem with transgender or any of that, but I mean, medically speaking, how do you bill out for those people? That's where the difficulty comes in. So great question. Yeah. Okay, any other questions? We can have open discussions about anything that you guys may want to know. Miss Crystal is here. She can answer different questions as a healthcare provider herself. Or if y'all just want to share an experience that you've had at the doctor's office.
My class is quiet. Courtney and Angel are the only ones speaking up. Somebody can say something. I mean, even if you want to talk about the SIMS chart, I know you all are going to be glad we're getting out of that. Friday is the last day next week for the SIMS chart. So, I mean, any questions or concerns? I bet you all are stop, because guess what? If you are all on here, then you will not have to be on the 4 p.m. Zoom call. And you and you will get your extra points today. So, I mean, we need look.
Why are you saying that out loud? Although my class is having a competition right now, that whoever attends the most Zooms until August the 1st, they're going to get bonus points. So I have been sitting here looking for my students to make sure I've got them all on here. And let me tell you, some of them are tied. Some of them are tied. Justice.
So some questions. I mean, it could be about SIM charts, some difficulty you all are having. We need some communication.
All right.
I have something to say about prior. Authorizations.
Angel, okay.
Yeah, so I have a medication, a very expensive medication that requires a prior authorization. And I try to be prepared for it because sure enough, when I go to the pharmacy and I try to refill my prescription, they'll tell me it's expired or something like that. So I try to be ready for it. And I was trying to understand or get an understanding of what a prior authorization is. And
Now-
when I thought that I had the hang of it, they changed it, the next year. They changed the rules of the prior authorization. Before it had to be done on a brand name medication. And then now it's no longer the case. So you can't even really prepare because as soon as you do know the rules, they're subject to change, I suppose.
Girl,
Yeah, they do change it a lot
they
because
change with the wind.
some medications, they require it depends on the medication. Some medications, they require a pre-authorization every time that it has to be filled. Some
Wow.
you can get a prior authorization up to a year. And then, like I say, some you have to, the doctor is supposed to send over one every time that particular prescription needs to be filled. That's why I say when it comes to the pharmacy, prior authorization can be a headache.
Yeah, and you have to be really proactive if you want your prescription paid for, because you can't always depend on the doctor to handle up on it right away.
No,
Like it'll take days.
Yeah. So who suffers if there's no prior authorization?
The
The person
patient.
trying to get their medication.
Patient suffers. So
The
that's
patient.
why when you're working in a medical facility and say that you're hired to be an authorization clerk, which jobs like that come up all the time, it is going to be your job to make sure that you have every patient's pre-authorization. Well, how does that work? So on Friday, you're working Monday patients. On Monday, you're working Tuesday patients. On Wednesday, you see how, so you have all those prior authorizations ready to go. And it's just a matter of you making the phone calls to the insurance companies to get those.
Because sometimes what we would have to do at the pharmacy, like, let's say we would put in the request for a pre-authorization and the doctor doesn't look at it automatically or doesn't give us feedback, we would literally have to tell the patient, well, sometimes what we would do, we would tell the patient, since you're here, call your doctor's office, let your doctor know that you're here right now at the office and you're at the pharmacy and you're trying to get your medication that you need, just so they can go in their system and and take care of that pre-authorization. So it like I say, it's a headache.
And you have to find good pharmacies that will sit there and work with you too, because like in Lafayette, we have probably about 10 million CVSs, but there's only 2 that I'll deal with because the pharmacists are actually nice.
Yes.
And they'll actually go above and beyond. Like yesterday, I went at 9:00 yesterday morning for when they opened because I had to have a workman's comp card changed out. And it took them an hour for them to work with my workman's comp.
Yeah.
Wow. Well, I want to ask an honest question. How many of you enjoyed all getting together today and having a Zoom with everybody?
It was like a Zoom party.
I like that. Well, I just want to encourage, I really love this because I'm glad I was able to make it. That was from Jennifer. Thank you, Jennifer. I'm also the program chair for our program, and you may hear me on the phone sometimes.
They good?
Hey, Daphne, can you mute me, please?
Yes.
I love getting to know you guys, and everybody can lend their expertise or something that they've experienced. So I would love to do this again. Does not have to be 1500 form. This is just what I chose for today. We can have a big old ICD-10 coding party.
Yes, definitely. When we roll back
Because
around.
so many of my students are new and they haven't gotten to code yet. So how many of you have gotten to code? So there's not a lot of you. Oh my goodness, you guys, when we get into coding, You're going to have so much fun. Listen, when we do ICD-10 coding, we watch Dr. Pimple Popper. We code what's going on. Listen, I love gross stuff, y'all. I love it. I can't do vomit or poop. I don't do well with that. But I love like the pussy, woundy kind. I don't know. That's what I love. But we get to watch those videos and code what we see together. And so we'll definitely do more get-togethers. I think this is me and Miss Crystal's second time.
Yes.
So Miss Crystal, you get to do it next time, whatever subject you want to do, and we'll just follow you next time.
I think everybody would like to do the ICD-10 because my class is fairly new and we didn't really get to cover everything in ICD-10, but with their Ferris wheel, everybody will get a chance to go back around to it. And I think that's going to be a really important class for us to actually do together, the ICD-10.
That would be fun. Now, and listen, guys, if you have an idea of something that you would like to know about, something you would like for us to put together a presentation on, let us know. Let us know. We're happy to do any of it. So,
and then this communication with everybody coming together and getting to know each other and the different fields that some of you already working in is really, really beneficial as well.
Absolutely. Melinda, what did you start to say?
For the ICD,
CD-10.
Yeah, that it's kind of like hindering me from learning how to use it because it only works for me twice.
Yeah, the True Coder, yes, it's a pain. We're just gonna have to just work our way straight through it. It glitches. It's not a new thing. That's why I'm like, if the ICD-10 book, the ICD-10 code is actually in your book, use it. If not, Google it. And right now, we just need it to go in there so we can get our SIM chart done. We will learn how to be specific, precise, and accurate when we actually do that coding. I promise you, you will get it. And then you're going to be like, man, I wish I would have known how to do this when we did SIM charting. All right. Well, if there's nothing else, it was great spending time with you guys. I would love to, you might see me popping in your classes too. If we can do anything to help you, please let us know. We're going to be putting this Zoom as soon as I upload it to YouTube. I don't know how long it's going to take, but I'm going to do that. And then I will send it to Miss Crystal and she can put it where she wants it. If you guys need anything or any help, please let us know. And if not, we will see you next time.
So for my class, 157.14 and 157.16, for those of you who are on, you do not have to log on for 4 p.m. I will send the email out to everyone. And if you all can get in contact with someone, if they're not receiving their emails or phone calls, please let them know we will not have a 4 p.m. Zoom. I have 18 of you on today, so that is great.
We have 24 students on board right now.
Yes, so thank you all so much for joining, and we will not have a 4 p.m. Zoom. This is our Zoom for today, so you all can continue to work on your assignments, and we'll be putting everything out for next week, the last week of this module. The next module is only 6 days, 5 or 6 days, 5 days.
5 days. If you
So
want to
the
do
next
something, if you want to be working on something extra, be working on a cover letter and your resume. Because that's what our next 5-day module is it's professionalism.
Yes, Jennifer says she's been working in SIM chart all day.
Poor thing. Oh, all right, guys. See
Yes.
you later.
No
Bye.
Zoom, no 4 p.m. Zoom. Remember, no Zoom.
No 4 p.m. Zoom, everybody.
Bye-bye.
Bye, everybody.
Bye.